Myself, Dr. JIBRAN Ahmed presents to you Simply Pathology, and today we are back with a very important video. Today we are going to discuss cell as a unit of health and disease, part 5. Now, very importantly, in today's topic of discussion, we are mainly going to discuss about growth factor and its receptors. Along with that, we are going to discuss in details about the extracellular matrix components. So today's topic of discussion is a little bit boring because it is a little bit theoretical, but again it is very important because lots of short questions are coming from this particular portion. So let us begin today's topic of discussion. So basically the growth factors and its receptors. So normally the growth factors, okay, they are stimulating several signaling pathways and they are also stimulating the cell growth, survival and division. So whenever a growth factor, okay, is combining with the growth factor receptor, they stimulate cell cycle, they can prevent apoptosis, they can relieve the brakes on cell cycle checkpoints, and they can allow the cell proliferation or cell cycle to continue. They can enhance synthesis of macromolecules like lipids, proteins, carbohydrates, nucleic acids, okay. So all these things are very important for proliferation and survival. If this is dysregulated, okay, if it is dysregulated, it can lead to malignancy, okay, very important, it can lead to malignancy, okay. Now remember, growth factor can bind to the growth factor receptor either during the steady state or in the normal situations, or when growth is required or at times of injury, okay. This is the time when growth factor will go and bind with the growth factor receptor, okay. So the first very important growth factor that we are going to read about, they are epidermal growth factor and transforming growth factor alpha, TGF-A. So both of them, they belong to the EGF family, epidermal growth factor family, and they have shared receptors as well as overlapping functions. The source of both of them are activated macrophages, keratinocytes and other cells. Now EGFR receptor families, they are composed of 4 membrane receptor families which are having intrinsic tyrosine kinase activity, okay, and these are the receptors where the EGF and the TGF-A growth factors are going to combine. Now the best known EGFR receptor family is EGFR1 or ERBB1, okay, mutation of which is seen in carcinomas of the lungs, breast, head and neck carcinoma. Now another receptor of the family is ERBB2, that is also called as HER2 receptor, which is overexpressed in a subset of breast carcinoma, which we say HER2 positive breast carcinoma. Now very important thing is that these important receptors, they are belonging to EGFR family, that is epidermal growth factor receptor family. Now if you consider the functions of the epidermal growth factor, they are mitogenic for many cell types, okay. Mitogenic means they are causing cell proliferation of many cell types. They are causing mitosis of many different types of cells. Number one, they are responsible for cell migration and they also stimulate formation of granulation tissue. Looking at the function of TGF-A, they basically stimulate the proliferation mainly of hepatocytes and many other epithelial cells, okay. Coming to the next important growth factor, that is the hepatocyte growth factor, also called as the scatter factor. It is basically released from the fibroblast stromal cells in the liver as well as the endothelium. They are mitogenic mainly for the hepatocytes and most of the epithelium, including the biliary epithelium lining the lungs, kidney, breast and the skin. They act as a morphogen in embryonic development. So they influence the pattern of tissue differentiation, okay, during embryonic development, okay. Then again, they are also playing an important role in cell migration. They enhance hepatocyte survival and they increase cell motility. They are formed as an inactive precursor, that is pro-hepatocyte growth factor, which again forms an active form, that is hepatocyte growth factor, which is acting on its receptor, that is MET receptor, okay, which is again having intrinsic tyrosine kinase activity. Now the MET receptor mutations are classically seen in renal and papillary thyroid carcinoma. So with this, we have completed the hepatocyte growth factor, also called as scatter factor. The third important growth factor is your PDGF, that is the platelet derived growth factor, okay. They are basically released mainly from the platelets, macrophages, endothelial cells, smooth muscle cells, keratinocytes and also certain tumors. Now why they are called as PDGF or platelet derived? Because first they were they were recognized as being released from the platelets, okay. Now they are basically, if you look at the functions, they are chemotactic for the neutrophils, macrophages, fibroblasts, smooth muscle cells. They activate and stimulate the proliferation of fibroblast endothelial cells and they also stimulate extracellular matrix synthesis. If you see, all these functions are very important during chronic inflammation and during tissue repair, okay. Now remember, there are 3 isoforms of PDGF, isoform AA, AB and BB. These 3 isoforms of PDGF, they directly they are biologically active. That means they do not require any kind of activation, whereas other two isoforms, that is PDGF, CC and DD, they require activation, and that is achieved by proteolytic cleavage. Okay, remember, they require activation. Now PDGF, they are stored in the cytoplasmic granules and they are released by activated platelets, as we have already seen, and they are acting basically via two cell surface receptors. Both of them have tyrosine kinase activity, that is PDGFR alpha and PDGFR beta. Now always remember, PDGF is a very important short note that is asked in the exam. So you have to write about all these important points, okay, to score good marks. Okay. The next very important growth factor, which is also asked as a short note, that is the VEGF, that is vascular endothelial growth factor. Again, they are released mainly from the mesenchymal cells, okay, of any tissue, and they are a family of homodimeric protein, okay, and there are many types of VEGF like VEGF A, B, C, D, as well as we are having PIGF, that is placental growth factor, which is also one type of vascular endothelial growth factor. Now very importantly, VEGF-A, this A variety, if you see, it is the major angiogenic factor, and simply it is also called as VEGF. So when we are just speaking about VEGF without mentioning any subtype, we are mainly talking about VEGF-A, and it is the major angiogenic factor, okay, which is basically released and which is basically helping in angiogenesis in injured tissues, okay, which is undergoing repair and healing, as well as in very fast growing tumors. They also release VEGF or VEGF-A, which is basically causing development of blood supply or angiogenesis to gain nutrition. Either it can be for a repair purpose or for growth of a tumor. Now VEGF-B as well as PIGF, if you see, they are mainly responsible for embryonic vessel development, whereas VEGF-C and D, they stimulate both angiogenesis as well as lymphangiogenesis. Angiogenesis means formation of the arterial blood vessels, lymphangio means formation of lymphatics. Now overall, the VEGF, all these factors, they have an important role in the maintenance of normal endothelium with highest expression in fenestrated epithelium, like for example the kidney podocytes, the retinal pigment epithelium and the choroid plexus. The most important inducer or the most important stimulus for release of vascular endothelial growth factor is hypoxia, and that occurs via release of transcription factor HIF1, that is hypoxia inducible factor 1. Okay, what are the other inducers? Okay, what are the other inducers of vascular endothelial growth factor? These are any kind of inflammation or any place where there is wound healing and repair. They will also cause increased release of VEGF via platelet derived growth factor or TGF alpha release. So via the release of these factors, they will increase VEGF release. Now VEGF receptors, if you see, there are three important receptors: VEGFR1, vascular endothelial growth factor receptor 1, 2 and 3. Now very important, the VEGF receptor number 2, it is highly expressed in the endothelium, and they are the most important receptors playing an important role in angiogenesis. So out of all the VEGF factors, if you see, VEGF factor number 2 is the most important. Now antibodies, now as we can see that vascular endothelial growth factor is very important even in the growth of a tumor. So any antibody, if it is developed against vascular endothelial growth factor, okay, they play an important role in the treatment of any kind of tumor like renal and colon carcinoma. In these carcinoma, there is increased angiogenesis which is supporting the tumor. So if we give anti-VEGF antibodies, they can help control the growth of the tumor. Secondly, VEGF is not only important in tumor, but they are also important in the pathogenesis of diabetic retinopathy or wet, ARMD or retinopathy of prematurity. So they are playing an important pathogenesis in all these conditions. ARMD is age-related macular degeneration. So in all these conditions, VEGF is having a big role. So very important, if you develop an antibody against VEGF, so that can also be used in the treatment of these disorders. Now there is one type of receptor, that is VEGFR1, that is increased amount of soluble VEGFR1. I am talking about the receptor. It is also called as SFLT1. So increased amount of this VEGFR1 receptor in pregnant woman. Okay, in pregnant women, they are playing an important role in preeclampsia. Preeclampsia is a condition in pregnancy characterized by hypertension and proteinuria. Okay, so in that condition, one very important factor that is involved is SFLT1 or VEGFR1. Okay, and they do so by sequestering the free VEGF. Now, normally VEGF is very important for proper placentation. Now, if this free VEGF is not available, it is sequestered by the SFLT1, then there will not be proper placentation, and as a result, hypertension and proteinuria is going to develop. The next very important growth factor is your Fibroblast growth factor. Now, it is a family of growth factors having more than 20 members. Now, fibroblast growth factor, if you see, they are having FGF1, FGF2 and FGF7. So, out of this, the FGF1 is the acidic fibroblast growth factor, FGF2 is the basic fibroblast growth factor and FGF7 is the keratinocyte growth factor. Now, they signal via 4 receptors, that is FGFR 1, 2, 3, 4 receptors, and all of them they are having intrinsic tyrosine kinase activity. The source is the macrophages, mast cells, endothelial cells, and they basically function as chemotactic agents and they are mitogenic for fibroblasts. They help in the growth of the fibroblasts. They also stimulate angiogenesis and they stimulate extracellular matrix protein synthesis. Now, the basic fibroblast growth factor, if you see, it has all the activities which are necessary for angiogenesis. So, most important fibroblast growth factor which is responsible for angiogenesis, mainly it is your basic fibroblast growth factor. Other important function of fibroblast growth factor is they are playing an important role in wound healing, hematopoiesis and also in development. Now, FGF7 or KGF, if you see, keratinocyte growth factor, they stimulate keratinocyte migration or proliferation or differentiation. The next important growth factor, if you see, is the transforming growth factor beta. Again, this is a very important. So, there are three most important growth factors are VEGF, transforming growth factor beta and PDGF. All these three are important short notes for the exam. Now, there are three important isoforms of TGF beta. If you see, there is a TGF beta 1, 2 and TGF beta 3, three important types. Okay, but remember TGF beta 1, if you see, out of all of them, the TGF beta 1, it is the most widespread. Okay, it is also called as just TGF beta. And the source of this is basically they are the platelets, T lymphocytes, macrophages, endothelial cells, epithelial cells, smooth muscle cells and fibroblast. Now, TGF beta, okay, remember they are released as a precursor protein. On undergoing proteolysis, they will become activated. Now, just like any other growth factor has receptors, so TGF beta also have 2 TGF beta receptors. What are these receptors? Type 1 and 2 TGF beta receptors. And these are having serine threonine kinase activity. They don't have tyrosine kinase. So, this is the only one which is having serine threonine kinase activity, and they are basically stimulating the transcription factor, that is SMADs, which can ultimately cause either stimulation or suppression of gene transcription. Now, TGF beta, if you see, they have multiple and often opposing effects. Okay, so they are also said to be a growth factor, okay, which is pleiotropic with a vengeance. Okay, so transforming growth factor beta, they stimulate the production of collagen or fibronectin as well as proteoglycans. Okay, and they inhibit the collagen degradation by decreasing the activity of matrix metalloproteinases and increasing the activity of TIMS. TIMS is nothing but tissue inhibitor of matrix proteases. Okay, now therefore they are playing an important role. Okay, TGF beta, they play a very important role, number one, in scar formation, as for example in wound healing. Not only that, they are the major growth factors responsible for fibrosis, as for example that is taking place in the lungs, liver, intestine, kidney, or in the setting of chronic inflammation. Now, TGF beta, remember, not only that, they are also anti-inflammatory in nature. They put brakes. If you see the third important function, they are putting brakes on inflammation. So, they are anti-inflammatory and they do so by inhibiting lymphocyte proliferation. They are also stimulating extracellular matrix synthesis, and very importantly, they are also chemotactic for leukocytes and fibroblasts. So, these are the very important 5 important functions of TGF beta, and this is very, very important growth factor for wound healing. Okay. Now, we have just completed all the growth factors. Now, we are going to the second leg of today's lecture, that is we are going to discuss about the extracellular matrix. It is very important. So, first we are going to see certain general points. So, extracellular matrix, they are mainly providing mechanical support. So, they provide mechanical support to the tissues. They help in cell migration. They are also responsible for maintaining the cell polarity. Okay, so they are very important regulators of cell proliferation. Okay, and how do they regulate the cell proliferation? By binding or displaying the growth factors. Okay, so very, very important that how they are playing role in cell proliferation, because they are binding many growth factors, and under many situations, okay, they are acting as a as a depot or as a deposit center for many growth factors, and under under required situations, they release these growth factors, which is helping in cell proliferation. Not only that, they are also playing an important role in cellular signaling via the cellular integrin family receptors. They are playing an important role in cell signaling. Okay, This is the second important function. They play an important role in cell proliferation by releasing growth factors and also via influencing the cell signaling via the integrin family receptors. Then they are also acting as a scaffold for tissue renewal. So they are providing a backup space. They are providing the dhacha or the tissue renewal scaffold. Okay, so it is providing a place where the tissue renewal can take place. Okay, so basement membrane and stromal scaffold, okay, it is very important for maintenance of normal tissue architecture plus organized tissue regeneration or repair. So for any tissue repair or regeneration, the stromal scaffold and presence of basement membrane is very important for proper tissue regeneration or repair. So what are the major functions of the ECM? Mechanical support, cell migration, cell polarity, cell proliferation via display of growth factors and cell signaling, scaffold for tissue renewal. Also, they are forming the foundation for the establishment of tissue microenvironment. Example, in the kidney basement membrane, if you see inside the kidneys, the basement membrane, in addition to acting as a boundary, they are also acting as a filtration apparatus. Okay, so at places they are forming very important tissue microenvironment. For example, the basement membrane acting as a filtration apparatus in the kidney, they are also part of an ECM. So these are the very important functions of the extracellular matrix. Now the extracellular matrix is constantly being remodeled. What is the meaning of that? It is constantly getting synthesized as well as it is getting degraded. Both of them are occurring simultaneously so as to constantly remodel. For example, how in our phone we are having the software that is constantly getting upgraded. Similarly, in the new version you will see some functions are retained, some functions are removed. So in that same way, our extracellular matrix is also getting remodeled continuously. Okay, so very important that this ECM, the extracellular matrix, is playing an important role in morphogenesis, tissue regeneration repair, chronic fibrosis and even tumor invasion and metastasis. Okay. Now if you see broadly, there are two types of extracellular matrix that we see. One is your interstitial matrix, another is your basement membrane. So first we will read about the interstitial matrix. In general, what is the interstitial matrix? Any space that is there between two cells, okay, that is your interstitial space. So it is occupying the spaces between the stromal cells within the connective tissue or between the parenchymal epithelium, and they are also underlying the vascular and smooth muscle structures in some organs. So they are basically the space either between the stromal cells within connective tissue or between the parenchymal epithelium, okay, or underlying, or they are basically present underlying any vascular or smooth muscle structure in some organs. You will find this interstitial matrix. Now they are basically synthesized by the mesenchymal cells, mainly the fibroblast. Okay, they are basically secreted as an amorphous semi-fluid gel. Okay, in some tissues like the GIT, urinary bladder, or in the soft tissues, the fluid within the matrix, that is the semi-fluid gel that is containing some fluid. So in some important tissues like the gastrointestinal tract, the urinary bladder, or even the soft tissues, the fluid within the matrix is cushioning the tissue compressions which is experienced during peristalsis, during urination, or during pulsatile arterial blood flow. Okay, so in all these places, okay, where some some amount of tissue compression is there, so you require this interstitial matrix that is amorphous and semi-fluid gel like. So in some places they become semi-fluid gel so as to allow tissue compressions to occur. Okay, the major non-fluid constituent of the interstitial matrix are fibrillar and non-fibrillar collagen, fibronectin, elastin, proteoglycan and hyaluronate. So the interstitial matrix is formed of fibrillar and non-fibrillar collagen, fibronectin, elastin, proteoglycan and hyaluronate. The second important component of the extracellular matrix is your basement membrane, which is mainly specialized surface for cell growth. It is basically providing a very specialized surface where cell growth can occur. Okay. The interstitial matrix within the connective tissue becomes highly organized around epithelial cells, around endothelial cells and around smooth muscle cells to form basement membrane. So just surrounding the epithelial cells, just surrounding the endothelial cells, just surrounding smooth muscle cells, you will have a basement membrane, which is nothing but a very highly specialized form of interstitial matrix. The basement membrane material synthesized by overlying epithelium and underlying mesenchymal cells. So for example, if this is an epithelial, okay, this is the epithelial lining, for example, okay, this is the epithelial lining, and for example, this is the basement membrane, okay, and beneath there you have the mesenchymal cells. So both the mesenchymal cells and the epithelial cells above, they are contributing towards the formation of this basement membrane by synthesizing the basement membrane material, okay. They are actually, the basement membrane, they are flat lamellar mesh and they are basically porous in nature. They allow substances to pass through them. The major constituent of any basement membrane, they are composed of type 4 collagen as well as laminin and certain proteoglycans, okay. So with this, we have broadly classified the extracellular matrix and now we are going to go into the specifics. So if we see the components of the extracellular matrix, it is composed of fibrous structural protein, that is, for example, collagen elastin, which is responsible for providing tensile strength and recoil. Then they have certain water hydrated gel also, which is basically in the form of proteoglycans and hyaluron, which is providing compressive resistance and lubrication, okay. And we are having adhesive glycoproteins, which is connecting the extracellular matrix elements to one another. So these are the very three important broad components, okay. This was again one classification. This is the classification according to the structure, interstitial matrix and basement, and this classification is according to the function, okay. So now we are going to first start with the collagen. So collagen is basically composed of three separate polypeptide chains which are binding with each other to form a triple helix. Around 30 varieties of collagen type has been identified. Now if you see collagen, structure wise they can be classified firstly as fibrillar collagen and non-fibrillar collagen. So let us first speak about fibrillar collagen. So collagen type 1, 2, 3 and 5, okay, they form linear fibrils, okay, and they are examples of fibrillar collagen. They are the major portion, they form the major portion of connective tissue in the bone, tendon, cartilage, blood vessel, skin, healing wound and scar. They are the one responsible for tensile strength, and this tensile strength is provided by lateral cross-linking of the triple helix of the collagen via the covalent bond that follows lysine hydroxylation, and this step is dependent, this lateral cross-linking step is dependent on vitamin C. So children which are having vitamin C deficiency, they have skeletal deformities and they have poor wound healing and easy bleeding, okay. This is very, because if you see the collagen is forming the important part of bone, tendon, cartilage, so skeletal deformities, easy bleeding because they are forming part of blood vessel also, and poor wound healing because collagen is also forming part of healing wound and scar, okay. So anywhere where this process of lateral cross linking, okay, is affected, okay, then in that situation you will develop these clinical sign symptoms. So it is very important, the tensile strength of collagen occurs because of lateral cross linking of the triple helix via the covalent bond that follows lysine hydroxylation, and this process is dependent on vitamin C. Now genetic defects of collagen synthesis or even genetic defects in lysyl hydroxylase enzyme, if there is a mutation or defect in the lysyl oxidase enzyme, that is going to impair this lateral cross linking, and ultimately these defects give rise to certain disorders like osteogenesis imperfecta and Ehlers-Danlos syndrome. Details of these have been discussed in genetics topic, so you will see in details about them when we read about genetics. So this is basically about your fibrillar collagen. Then we are having non-fibrillar collagen. If you see, the most important example is your type 4 collagen, which is mainly present in the basement membrane. So they help regulate the collagen fibril diameter. This is the main function number 1. Also they help to maintain collagen interaction via facets. Example of this is type 9 collagen in the cartilage. They also provide anchoring fibrils, okay, which maintains the structure of stratified squamous epithelium. For example, type 7 collagen, okay. Mutations over here in the anchoring fibrils is responsible for blistering skin disease, okay. And we have also seen basically, so these are the important functions. They are forming as a basement membrane, the type 4 collagen, regulating collagen interaction and collagen diameter, the type 9 collagen and cartilage, providing anchoring fibrils, okay. They provide anchoring fibrils which is responsible for maintenance of structure of the stratified squamous epithelium, okay. So mutations over here can lead to blistering skin disease. So structurally over here there are two types, fibrillar, non-fibrillar collagen, as we have seen, along with their functions. Now we are going to understand the collagen biosynthetic pathway. If you see, from the DNA, they will give rise to mRNA, which will undergo splicing and processing to form the mature mRNA, and that is going to give rise to a precursor pro-alpha chain. All this step is taking place inside the nucleus. Now this pro-alpha chain, it is going to undergo proline lysine hydroxylation as well as lysine glycosylation. This is very, very important, okay? And after this, the 3 pro-collagen chains they are formed, which is going to align to form a triple helix. So 3 pro-collagen chains is going to form a triple helix, and the carboxyl end of the propeptide. Now there are 2 ends. One is the N-terminal end, one is the C-terminal end. So the carboxyl end of the propeptide is completely removed before they are secreted from the endoplasmic reticulum and the Golgi apparatus, and this removal of the carboxyl end is under endoproteinase activity, okay? So very importantly, all this hydroxylation, glycosylation and the cleavage of the carboxyl end, they are taking place in the endoplasmic reticulum and the Golgi apparatus. In short, before they are secreted, okay? Now, once they are secreted into the extracellular space, they are called as pro-collagen and they do not have the carboxyl end, okay? Now, the N-terminal end, the length of that can vary depending on which type of collagen is formed, okay? But once the pro-collagen is going to come, they are going to undergo what is called as lateral cross-linking via the formation of covalent bond, and for this process lysyl oxidase enzyme is required, okay? And the lysyl oxidase along with the previously hydroxylated residues, whatever residues have been hydroxylated, like the proline and the lysine residues were hydroxylated, that hydroxylation along with the lysine oxidase is very important for collagen lateral cross-linking, which is providing the tensile strength and forming the mature collagen, and all this step they are taking place at the extracellular space. So if we see, in short, initially there is a endopeptidase processing giving the procollagen, okay, then there is the lysine hydroxylation, okay, that is giving rise to ultimately cross-linking. If there is any defect anywhere in the process, it can lead to connective tissue laxity, okay. Now